All right, pharmacist interventions part 17. 3 of these were from today, and then 1 of these was from yesterday. So yesterday I had a patient picking up Lamictal 150 milligrams, and I didn't see any recent history of like a titration up, because you need to titrate that medication up over a few weeks. Again, Stevens-Johnson syndrome, most patients know. He said his last dose was in April. He was on it in the past, he stopped taking it, and then he went to the ER and was having seizures, I guess, and then they just started him at 150. So I told him he needs to retaper that. He can't just start at his last dose, again, due to Stevens-Johnson syndrome. Today I had a patient who was prescribed metformin, and the directions were take 500 milligrams on day 1, which is 1 tablet. On day 2, take 500 twice a day. On day 3, take 1,000 in the morning and 500 in the evening. And day 4, take 1,000 in the morning and 1,000 in the evening. Metformin needs to be tapered. You increase the dose by 500 milligrams every week. So they maxed them out after 4 days. So I'm assuming some GI upset, nausea, diarrhea with that. I put a forced note on it to counsel him at the register. The system did not flag that, but I caught it because I thought it was weird when I was entering the instructions, and I was like, oh, this is tapered incorrectly. It's supposed to be 500 daily for a week, and then you increase to 1,000 as the patient's tolerating it, and then go on from there. But I'm going to talk to him later this week once I see him pick it up. I had a patient picking up, I think it's called Zelstarime or something. I don't know how to pronounce it, but it's a dextroamphetamine, like extended release patch. And it was flagging against Vyvanse. She discontinued the Vyvanse. But then I also saw we were in process with the Wellbutrin. So both of those are DNRIs, basically, increased dopamine and norepinephrine. So I asked if she's on both. She said yes. I said, okay, we'll just monitor for side effects of just too much norepinephrine or dopamine. Like if you're having like headaches, insomnia, dry mouth, stuff like that, anxiety. And she was like, I'm glad that you said something, because I've been having like headaches like nonstop, like for like a while. So I thought that was interesting. And I was like, well, it's probably the Wellbutrin that's causing these. And she said, yeah, yesterday I just had a really, really bad one that just didn't go away. And I said, okay, follow up with your provider to go from there and maybe decrease your dose or taper off of it. You can't just stop taking it. So she's going to follow up with her provider.